Has your doctor told you that your hemoglobin or hematocrit is high, but you don't smoke or live in high altitude, and you're wondering what is going on? One sneaky cause may be something people don't always know about. It's untreated obstructive sleep apnea. And yes, it can even cause symptoms like fatigue and itchiness that no one connects to your blood counts. Hi, I'm Dr. Valerie Cacho, an integrative sleep physician and women's sleep expert with over 12 years of experience in helping folks just like you improve their sleep and overall quality of life. So here's a short answer. Sleep apnea drops your oxygen levels when you sleep, and your body responds by making more red blood cells to carry around the oxygen. This raises your hemoglobin and your hematocrit. Over time, this can make your blood thicker, which may lead to symptoms like fatigue, headache, or itchiness. Treating the sleep apnea often brings those levels back down to normal. So why does this happen? When you have obstructive sleep apnea, your upper airway in your throat and posterior oropharynx repeatedly collapses at night, and every time your oxygen levels drop, your kidneys send out a hormone called erythropoietin. This tells your bone marrow to pump out more red blood cells. The more red blood cells you have higher levels of hemoglobin and hematocrit, especially as your body is trying to adapt to low levels of oxygen. What are the risks of having too high hemoglobin hematocrit? Well, at first it actually may seem helpful, but here's the problem. When you have too many red blood cells, it makes your blood thicker, almost like syrup or glue. And this raises your risk of having blood clots, strokes, or even heart issues. Some symptoms that you may notice: people with elevated hemoglobin hematocrit sometimes develop symptoms similar to polycythemia, and these can include fatigue, because your blood is so thick it doesn't deliver oxygen efficiently. You can have headaches or dizziness, and itchiness, especially after a warm shower or bath, and this happens because those extra red blood cells can change how your blood vessels react. Blurry vision or ringing in the ear have also been associated with too much red blood cells. Also, having a ruddy or red flushed skin tone can be associated with this condition. Now, not everybody with sleep apnea or sleep apnea related polycythemia gets these symptoms, and sometimes I see patients and their blood levels are high, so their doctor sends them over for a sleep test. But if you do, it can really affect the quality of your life. Other causes to rule out, and it's not always from obstructive sleep apnea. Doctors can also check for things like smoking, any underlying lung disease, testosterone use, living at high altitude, or a bone marrow condition called Polycythemia vera, or it could be in your genes and it could run in your family. However, if you in fact snore, feel tired throughout the day, wake up with a headache in the morning, sleep apnea may be that hidden cause. The good news is treatment does work. So treating obstructive sleep apnea either with a CPAP or other therapies such as an oral appliance or an implant can really bring those blood levels back down. I've seen patients going from needing regular blood draws to keep their hematocrit and hemoglobin in check to normal count just by treating their obstructive sleep apnea, but it does take a couple months for these numbers to resolve. So if you've been told that your blood counts are high and you're dealing with fatigue, headache, and itchiness, do not ignore it. Please ask your doctor if sleep apnea could be the cause and go ahead and get that sleep study done. If you found this video helpful, please hit the like button. And to learn more about sleep apnea and women's sleep concerns, check out our other videos. Until next time, sleep well.